Okay, we're going to go ahead and get started again. Our next session is on coping, and here to present on that is our Dr. Kristin Kilbourn, who's an associate professor in the Department of Psychology at the University of Colorado, Denver, and she is also a member of our chapter medical advisory board. And with her is Catherine Shire, who is one of her doctoral students in the clinical health psychology department.
Good afternoon. Great to be here in this somewhat challenging room. So we're used to doing groups and things, so hopefully we can feel like we're connecting to all of you. So today we're going to talk about coping strategies, specifically for you as parents. And just to know, a big area of research for me is working with caregivers. So caregivers of children, caregivers of spouses, caring for parents, things like that. So we're going to talk about some different strategies that may be helpful. Some of these you may be already doing. So you may leave here saying, whew, I'm doing a pretty good job, my own self-care, taking care of myself and coping. Or hopefully you may learn a few things also today. How many of you, just a show of hands, feel like you're doing pretty well in terms of coping with the stress of caring for a child with health issues? Okay, great. Anything that any of you that raise your hands want to share that you found that's been really helpful?
I think I have a little bit of a heads up because I'm in the medical profession. So I have tons of people I can talk to on a daily basis. I'm familiar with all the medications.
Yeah.
And so it just gives me a little bit more confidence in what I'm doing.
Good. So in terms of like the information and those kinds of things, it's much easier for you. Okay. Yeah, that's great. That's a great, because that can be very, very stressful, right? Of figuring out all the medical jargon and trying to understand that, where to get good information. Who are some other folks that raise their hand over there? Maybe what some strategies that you want to share that have worked well for you? And maybe.
Learning how to breathe.
Learning how to breathe.
Going to the doctor myself and figuring out like healthy coping mechanisms when the unhealthy ones kind of stop working.
Yeah.
And knowing that it's a roller coaster, that some months or some days or some hours I'm gonna be really good. And then the next day it's going to be different. So ride the highs and, ride out the lows.
Yeah. Yeah. So it's that sort of unpredictability, right? Recognizing that you need to be, prepared for that uncertainty and unpredictability and flexible in how you approach that. And I like that you talked about your own self-care. And we are going to touch on coping, healthy and unhealthy, or sometimes we say adaptive and maladaptive. So Katie's going to talk about that. So those are, and the breathing, we're definitely going to talk a little bit about that too. So those are great examples. How about others? Anyone else have something that they found that's really helpful for coping with the stress and disruption that comes along with having someone in your family who's dealing with health issues?
I don't know if it would translate to this group because I don't have a child with scleroderma. I'm here as one of the professionals, but putting on my other hat and being the caretaker of a mother with Parkinson's and a father with Alzheimer's, I feel like finding other people going through similar situations is incredibly helpful. So I can only imagine that groups like this, where you guys are actually getting to meet other families and sharing, oh my gosh, I'm not the only person in the world going through this, is especially with rare illness. I mean, what I'm dealing with, those are relatively common aging issues. But if you've got a child with a rare illness, I can imagine it feels like you're like the only person going through that. And so I think, yes, the educational part of this is absolutely huge, but I think just as important to find other people and connections to relate to is
Really,
just having someone say, I get it, like goes
Exactly.
so far.
And you don't have to feel like you have to explain. You don't have to figure out how much information do I need to disclose to them. So that social support piece is really, really key. And we're going to hit on that a little bit today too. That's a great one. Any others? Okay, so let's talk a little bit. So let me make sure I have the right button here. There's like so many screens in here. It's a little overwhelming. I don't even know where to look. I'm just going to look at all of you. So let's talk about the challenges experienced by, I'm just using the term caregivers, but parents and other people that may be involved in caring for someone with health issues. So certainly there's different ways that it impacts us. So we know the physical, right? So what are some of the obvious sort of physical things, physical demands or physical symptoms that you may experience as a caregiver? Any ideas? Maybe not getting enough sleep, feeling sleep deprived, fatigue, right? So feeling tired, fatigued. Sometimes caregivers, although, and I'm glad it's already come up, but we know this from the research that caregivers often are not very good at taking care of themselves, right? And I think parents in particular, because there's so much of that focus of taking care of your child, that often you put off your own self-care. This could be in just, diet, exercise, getting enough sleep, but it can also be in things like even going to your doctor for regular checkups or doing the things that that are good for your health and your own well-being. So that's a big, really important key thing I want you to be thinking about in terms of your own self-care. And we do know that the research has shown that caregivers, just the fact of being a caregiver, you are increasing your own risk of morbidity and mortality, right? So we know that caregivers, there's a lot of stress associated with that, and then they don't take good care of themselves. So that's just something to also, another reason why you want to take good care of yourself, because you want to be able to take care of the people in your life that you love. So you need to start with taking care of yourself. Okay? We know there are a lot of emotional stressors and challenges, certainly. We already talked about the uncertainty. So especially when you're dealing with an illness like scleroderma or autoimmune disorders, I think one of the biggest challenges that makes autoimmune disorders so distinct from a lot of other what we think of chronic health medical issues is the uncertainty, right? That sort of day-to-day uncertainty. Is it going to be a good day for my child, a bad day? What kinds of things may be coming up? Can we plan for things? So a lot of stress related to uncertainty, anxiety, fear, anger. That's a common one. The anger of like, why does our family have to deal with this? Why does my child have to live with this, right? It's not fair. Sometimes it can lead to social isolation. So it may be because scleroderma being such a rare disorder, it's hard for people to really understand what that's like. So sometimes people, especially when we're really distressed, we may isolate and just tend to not socialize with others. And then we know that there's just a lot of issues around sort of adapting, always having to adapt to new things and sort of new things that may occur. And that takes a toll on us also. So like I said, anxiety, depression, all of those things. And then of course there's the practical, which mixes into here. So could be things like financial stressors. Sometimes it's changing of roles. For example, sometimes parents have to switch around where one parent may need to take time off work or have a change in employment so they can spend more time helping to care for their child or other children. So there's a lot of disruption in that. It could be work-related, financial stressors, certainly. Maybe taking on new responsibilities, sometimes medical responsibilities for those of you who don't have a background in medicine or healthcare, things that you maybe never ever imagined yourself doing to help your child. So again, many challenges that caregivers experience. Any others that aren't on here or that would be important to note? So let's talk about now what are some strategies for maintaining good emotional and physical health. And you all have really good, we all have good reasons for why we need to do this, but especially as parents, right? That taking care of ourselves so that we have the energy, so we are able to take care of our child or our children or the people in our lives that we really care about. So we're going to talk about some different strategies today. I want to start with stress management. So what are some things that you have all found? So, when you're dealing with an illness like scleroderma or dealing with a child who has health issues, it's, as we talked about, very stressful. So what are some things? We heard breathing, which is a great one. What are some other things that people find help them in terms of managing stress? Exercise. So exercise is a great one. Spend time with friends. Yep. So the social part. Getting enough sleep, right? So when we get enough sleep, the stressors, they don't impact us as much, right? We're better able to manage different stressors as they come at us. So getting enough sleep. Any others that folks like? Okay, let's go through a few of those. So we already know chronic stress can lead to many different problems in different areas of our lives. So how many of you are familiar with cognitive behavioral therapy? Has anyone heard that term? Okay, so we're just going to brush along about it, but just to be aware, cognitive behavioral therapy can be very helpful in terms of helping us recognize our thoughts and how our thoughts can become distorted and actually produce more distress. So that can be a very good way of managing stress. So for example, right now with our some of the folks that are dealing with scleroderma who are adults, here locally, we're doing a stress management group. And part of that is teaching them some cognitive behavioral skills that they can use to help them manage stress when they're having distorted thoughts, be able to identify and change those thoughts. So I just want to put that out there as something that you might consider if you're finding like I'm really having a hard time managing distress. Cognitive behavioral techniques can be very helpful. And then relaxation exercises. So we talked about, someone already mentioned breathing. Deep breathing can be very helpful. How many people have tried meditation? Okay, well that's something to think about. There's all different types of meditation. How many of you have ever tried the apps? There's some great apps. So Headspace and different apps that you can try, which is really nice. You can just plug into your phone. Even 5 or 10 minutes of some type of relaxation can be very helpful. We talked about exercise. Some of the mind-body types of exercises too can be particularly helpful. So yoga, do you have any folks in here that like to do yoga, Tai Chi, anything like that? That's nice because it integrates the breathing along with the physical component. So that can be very good in terms of relaxation. For some people, prayer can be very helpful. So prayer, very similar to meditation, where you really can have that focus and you can bring in your spiritual beliefs, spiritual practices. And then the other thing that's really helpful and important that we don't always think about are engaging in hobbies and interests, right? So why do you think that would be helpful for managing stress? So it takes your mind off of it, exactly. So I always talk about how, thinking about things that are kind of more in that right brain side of your right hemisphere are really good for you. Creative activities that just get you away. Excellent, great example. So it can be very, very good. It also helps to reconnect you to who you are, right? So I bet there are folks in this room that have had to maybe give up or put aside some hobbies or interests because of the time that they've had to put into caring for their child. And sometimes that can add more stress to our lives because we don't have that outlet anymore. But also we sort of easily can lose our sense of self, right? We're so focused on taking care of others that we sort of lose our sense of self, and re-engaging in hobbies and interests helps us sort of reconnect to who we are. Does that make sense for most of you? So I want you to think about that. Sometimes I see people and I ask them, what are your hobbies and interests? And they say, well, I don't really have any hobbies. So then I'll say, well, tell me what you were like as a kid, or when you were a teenager, what did you like to do? What are the things you like to do? Sometimes, we may have hobbies and interests that we just don't have time for anymore, but maybe there's elements of those things that we really enjoy that we can figure out a way to still be connected to them. If that makes sense, right? So maybe you're a big nature photographer and you like to go on these big long hikes and do all this photography. Maybe it's hard to get on those hikes, but you can still integrate that love of photography somehow into your day-to-day life. Okay, so I want you to be thinking about those kinds of things, how you can engage in more hobbies or crafts or artistic sorts of activities to help manage stress. Now, communication is also one of those key factors that can cause a lot of stress and distress, especially within the family. Anyone have any wisdom they want to share about communication, things that they found that have been helpful in improving communication? It could be between dyads, couples, it could be within the family.
I don't get as much time with my husband to communicate just on a day-to-day basis because of doctor's appointments and everything that's going on. So we have a journal station, and so we can write notes to each other that way.
Oh, that's
So we
great.
don't feel as disconnected.
Wow, that's great. So is that something that's like actually somewhere at your
Yes.
house? Okay.
It's set up in our room, somewhere that's, the kids can't read it, It's important for us to have that, because it's how we are able to connect at this time.
Oh, that's great. That's a great idea, a journal station. I love that. What others? Anyone else have something they want to share that the group might benefit from that you found that's helpful?
I don't know if this qualifies as communication, but I painted a wall of my kitchen in blackboard paint because I have a lot of children.
Yeah.
And I just found that everything got easier when we put things in writing on the board. Even if it was like, I was worried I was gonna forget my husband's birthday the next morning. So I wrote happy birthday all over the board and the kids decorated it. And it was actually a really helpful thing because,
That's
otherwise
great.
it's possible I would have forgotten.
Yeah.
Also for practical things.
Yeah, exactly. So you can mix it up. That's great. Yeah, I love that. Any others you found that are helpful? Yeah.
Probably say don't make some assumptions. I mean, we've been going through this for 5 years next month, and I took on more work. Kim, my wife, actually retired, so that because there were just so many physical therapy sessions and everything else. And I think we were both kind of doing our own thing, but thinking that it was making it easier for the other person, and you ended up just not communicating. And I think that's, it's just a real stressor because you don't want to burden the other person, your spouse, with all the stress you're going through to make sure that you're living up to what needs to happen so that they can take care of the kid or whatever. And, you just kind of lose your spouse in this process. And that, it takes time to kind of get over that and just get back on track.
Yeah. Well, and it's because sometimes the conversations become so task-oriented. I mean, I think that happens to families regardless of even having a child who has medical issues, where you just become so task-oriented that you lose that connection with each other.
We ended up just talking for quite a while. What we were doing that we thought was helpful that it wasn't. And then really appreciating what the other person was trying to do and that we misinterpreted what it was.
Yeah, and that's a big part of, when we talk a little more about social support, that matching piece of like recognizing what the people in your social support network are really good at, what kind of support they're good at providing, and what kind of support maybe they're not so good at providing. And are you asking them for the type of support that they're able to provide, right? So that communication on what is it I need right now, what do I need from you, how can you communicate that effectively, rather than, as you said, just assuming that you know. So those are great, that's really important. So let's just go through a few of these. So one of the big factors, things to think about is, and some of you have come up with some great innovative ways of doing this, but could be just setting aside time to talk. And it may be sometimes that the best way you can do it is electronically or through a journal, but having that time set where you're going to communicate in some way, right? So that means actually planning for that ahead. It may mean also making an outline of what you want to talk about. Assertive communication, how many of you are familiar with that term? No one? A little bit, yeah. So assertive communication, it's really the easiest way to think about it is the I statements. Usually it's the I feel, right? So when we think of communication, we think of there's passive, or people are just sort of passive in their communication. They don't ever really talk about their needs. Then we think about aggressive communication, when someone says, you know, I don't like the way that you forget to take out the trash every day, or something like that, which is going to make the other person very defensive. With assertive communication, it's in the middle where you're able to assertively convey how you're feeling to your partner or someone that's in your social support network without provoking defensiveness, right? And I think all of the couples in the room can probably think of good examples, right? Where maybe it would have been better if I'd used a few more I feel statements, but I think these can be very important when we're thinking about communication and more effective communication, all right? The other thing that's really, really helpful, and again, this is especially for couples, but it's also can be great to use with your kids, is reflective listening. How many of you are familiar with that term? So that idea is that if your partner or even your child is telling you something, the best way that they know that you're listening to them is to reflect back what you're hearing. Okay? So oftentimes with couples, and when I do couples therapy, you know, we do this a lot. And oftentimes what happens is couples can get into this pattern where, kind of like was mentioned, they think they already know what the other person's going to say or what they mean. And so they just sort of jump to conclusions. They don't actually listen to them. So when you have to reflect back, it means that you actually have to listen and reflect back what you think you're hearing. And then it gives the other person a chance to actually correct you if you're wrong, right? So I do a lot of work with medical professionals actually on communication with patients. And we talk about this a lot, how they can use reflective communication also and reflective listening. And then we already talked a little bit about not jumping to conclusions. Whoops, I didn't mean to do that. Okay, so I'm going to turn it over. So now we're going to talk about some coping strategies that can be really helpful. We talked about the healthy and unhealthy, or adaptive and maladaptive. I'm going to turn over to Katie, and she's going to talk a little bit about coping strategies and see if you recognize any of your favorites in here.
Hi, everyone. So like we've talked about a little bit so far, there's different ways that we can cope with stressors, stressful situations, and life events that we go through. One important point about different types of coping strategies that we can use is it's important to match the type of coping strategy that we use to the type of stressor that we're dealing with. So I'll tell you a little bit more about what I mean by that. So we tend to kind of look at situations and stressors in two kind of buckets. So we look at them in terms of controllable stressors, controllable situations, and uncontrollable stressors. Can anybody think of an example of maybe a controllable stressor in their life, or something that they feel like maybe is a problem that they can change or they can do something about? Okay.
Trying to figure out how to do that.
Yes. Okay. So you're probably going to need to use some effective strategies to help him do that. The other type is uncontrollable, where we don't have any control over this, and dealing with caregiving or people or children that have chronic health issues. Sometimes there can be more uncontrollable stressors or things that we can't change. So the types of coping responses then that we use for each of these are going to be different. So for controllable stressors, we use problem-focused coping strategies. And so these can be things like problem solving, decision making, kind of gathering information that we need, goal setting, kind of what you talked about in terms of trying to figure out ways to get your kiddo to take his medication. Some problem solving is probably involved in that. And then for emotion-focused coping, or for uncontrollable stressors, we use emotion-focused coping. And this includes things like talking to others, using our social support to kind of vent, talk about how we feel, talk about the stressful situation, some of reframing. And this is kind of what Dr. Kilbourn talked about earlier in terms of cognitive behavioral therapy, giving us ways that we can try and reframe our thoughts or think about our thoughts differently in order to process the stressor or situation. Journaling, which was mentioned, journaling is a great way to not only connect with your spouse or partner and to utilize that social support, but also to effectively express our emotions and kind of process those emotions that we have with uncontrollable stressors. And then self-care practices, so things like exercise, relaxation, engaging in religious or spiritual practices or some type of meditation, and like Dr. Kilbourn talked about earlier, the importance of engaging in enjoyable activities that bring us back to what our values are and what kind of makes us feel like us. Does anybody have any questions about any of this so far? So this next table shows the difference between adaptive and maladaptive coping strategies that are within each of the categories. So we have problem-focused and emotion-focused strategies, and then within each of those, there are more helpful ones, and then there are more unhelpful ones. So for problem-focused, helpful or adaptive coping strategies include things we've already talked about, like information seeking, goal setting, problem solving, decision making, conflict resolution, and asking for help is a big one that's difficult to do. And within problem-focused coping, there's also some maladaptive or not super helpful coping strategies that we tend to use as well, which include avoidance. So behavioral avoidance, cognitive avoidance, just kind of not wanting to deal with the problem, not wanting to kind of put in the effort to come up with those strategies because it's hard sometimes to deal with these difficult stressors. And then on the other side, emotion-focused coping, there's a whole lot of adaptive emotion-focused coping strategies that we can use to help us deal with uncontrollable stressors. And again, these include self-care activities, also some of the reframing of thoughts or reframing your perspective about a stressor, and then healthy ways of expressing emotions as well as accepting negative emotions. So kind of what I think someone brought up earlier about trying to ride those hard times and softening the negative reactions that we might have to some of these stressors. And then also there are more unhelpful or maladaptive emotion-focused coping strategies. And those include things that such as like eating, overeating, drinking alcohol, smoking, and then not caring for yourself. So not adhering to a medical regimen if you have one yourself, not going to your doctor for regular checkups, things like that, and also not dealing with your feelings. So stuffing your feelings in and not expressing them in a healthy way. So lastly, just to summarize this a little bit, like we've talked about, there's a variety of different types of coping mechanisms we can use for different types of situations, and it's important to match the stressor to the type of coping strategy that you use to whatever might be most appropriate for that situation. And it's important to become aware of common coping strategies that you might use. So this is what Dr. Kilbourn was talking about in terms of people have their favorite coping strategies. And so we can ask ourselves questions like, in what situations do I use maladaptive coping strategies? Or in what situations do I use more emotion-focused coping strategies? So can anybody think of a situation or a time where they use more maladaptive coping strategies, whether that's for problem-focused or emotion-focused? Anyone? Okay. So when you're going through a difficult interpersonal situation, it's harder to use strategies that are more helpful for you.
You go to the bad ones.
Yeah, you do the bad ones. Yeah. Sometimes when you're tired, it's hard to not want to just sit in front of the TV and not deal with difficult feelings or difficult situations. Does anybody else have any other examples or anything that maybe wasn't up here that you feel like, I do this and it's maybe not the best for me, or I use this problem-focused strategy and it's really helpful for me?
I think sometimes, like I tend to, with all getting overwhelmed with my son, we're having a bad week or he's sick or something, I'll avoid people when I know that's probably, I probably need to get in touch with friends and talk to them but I kind of instead just I don't want them to see me like stressed or negative, so I just avoid everyone. And then that sometimes spirals. So it's better if I know when I'm doing it, but it's better if I just call my sister or just talk to somebody,
Right,
instead of hiding out.
Instead of
If I'm stressed,
isolating yourself. Yeah, and that can maybe often make us feel more isolated, right?
Yeah.
And then we can't reach out to people. Alrighty, so we'll go ahead and move on now to talk about social support.
So one quick thing that Katie was talking about with coping, just to make sure you understand this importance of matching, and I see it so often in the people that I work with. So if you think back, so an easy example probably for all of you is think to when your child was first diagnosed with scleroderma, okay? So lots of stressors and challenges then, right? So when we think about it, we could split those into what were the controllable stressors. So because most of our big major stressor life events are a mix of controllable and uncontrollable. So what were the controllable things? What were the things that you felt like you could control when your child was first diagnosed?
The power to make the medical decisions.
Exactly.
Not keep going when I'm told no, or put a cream on this. So I had the power and the choice to move forward.
So you were able to decide, or maybe in conjunction with your child, but what kind of medical treatment, where you would receive that, what medical teams, doctors, groups you would work with, right? So those are perfect. Those are some good controllable kinds of things, right? And that makes sense. We would use more problem-focused coping, right? So you can get information from people, you could go online, you're really using a lot of decision-making, problem-focused kind of coping, right? So what if you, for those stressors, rather than problem-focused coping, you were just so overwhelmed, just more emotional-focused coping, right? You were just really sad and maybe doing some things to help with your emotions, but you're not really coming to a conclusion or a decision to help with the problem, right? So it would feel like you're not getting anywhere and it could cause more distress. Does that make sense? So that's where it's really important. So that was controllable. Those were controllable things. So we use more problem-focused coping. If we used emotion-focused coping, we feel really, really even more frustrated and distressed. So let's talk about the uncontrollable. So what are some of the uncontrollable aspects to that major life stressor of your child being diagnosed with scleroderma? Any ideas? I mean, one huge one, yeah.
You don't know how long that flare is going to last. You don't know what the symptoms are going to be or how long they're going to go on.
Right. You don't have any idea, like, what does this look like long term, right? How is this going to go? How are we going to adapt to this and learn to live with this, right? A lot of people go through that period of why. Why does my child have this? You know? So these are some very uncontrollable types of stressors that you could spend days and weeks trying to solve these problems that are not solvable, right? We don't have the answers to these things, right? So here is where we're going to shift more to emotion-focused coping, because with these sort of uncontrollable stressors, we have a lot of distress related to that. And so the emotion-focused coping strategies that Katie just presented are going to be a much better match for dealing with those stressors, right? Does that make sense? Because it gives you a way to sort of manage some of those emotions in an adaptive, healthy way, right? Does that make sense? Did you have a question or comment?
Something that's, I know that has helped our family, that I didn't hear you mention in terms of coping, is laughter.
Yeah, humor actually should be on that.
Humor should
First
definitely be on that.
And that's an emotion focus. That's a great emotion focused coping strategy.
And it's definitely helped us on many occasions.
Yeah.
Just finding the humor in whatever, awkward situation or, painful situation, whatever. Humor always helps.
Yep. Humor's a really important one. That's great. Are there any others that weren't on there that people have found helpful?
For us, it's music and dancing.
Yeah. So music, dance, creative activities, oftentimes when you're doing those things, you don't realize it, but there's a lot of emotion that you're actually processing. Even if you're not aware of it, that's really helping you in processing some of the emotion around these uncontrollable stressors. So those could be really helpful.
I would probably say, you're accepting that certain things are uncontrollable. I think when you very first start this, you keep on thinking, okay, if my son takes every dose, he does everything right, we did all these different things that, typically with a regular disease, okay, you're cured. But then at some point, you just start to accept that if you don't accept that certain things are uncontrollable, you're just gonna go into a dark place of okay, what did I do wrong? And so you just kind of accept that it just is this disease, and you gotta just push through it, I guess.
Yeah, exactly. So that acceptance can be really important for those, especially emotion-focused, uncontrollable types of things. Yeah. Any others? Oh, sorry.
I've actually found advocacy very empowering, for myself and for my child as well. When we went to Washington with the Scleroderma Foundation, my daughter was, I think, the only one whose congressman actually came out to meet her. And she felt incredibly special. And it was just, it was basically recognizing that this entire situation was extraordinary and that this shouldn't be happening, but it is, and maybe there's a long game, maybe we can affect small changes. And so I think that has been very sort of therapeutic in its own way for us.
Yeah, that can be really, as you said, therapeutic and healing for people to get out there and advocate. That's a great one. Okay, well, just a couple others I want to touch on. So social support, we've talked a little bit about. So just a reminder, first thinking about, do you know how to ask for support, right? A lot of people are not very good at asking for support. So there are lots of people that tend to be very good at providing support. Like they're the ones that are always there when someone needs them, first one people call, and that feels really good, giving that support. But when they're in a position where they could really benefit from social support, they find it really hard to ask, right? I'm the strong one. I can't be asking for support, or I'm the one that's supposed to be there for everyone else, right? So the first step with social support is just learning how to ask for it and giving yourself permission to ask for it, right? Because the important thing to remember is, think of when we provide support to people that we care about in our life, it feels good, right? It feels good to be able to help others and feel like you're doing something for them. So why is it so hard for us to allow others to have that same opportunity with us, right? So that can be a way to get over some of those barriers sometimes for asking for social support. The second question, so maybe you're getting better at asking for support, but do you know who to ask? And this gets back to what we talked about a few minutes ago in sort of that not assuming that the kind of support you need, the person you're asking for that support from knows how to provide what you need, right? So this means we have to sort of tune in to what do I need right now, right? Do I need, and this also happens a lot with couples, right? So the classic is sometimes, for not to overgeneralize, but women oftentimes really just want emotional support. They just want to be heard. Like, I had a really bad day and I just want my partner, I just want to be able to talk about my bad day, and just having someone listen who cares makes me feel better, right? But oftentimes, again, not to overgeneralize, but men, they're more of like the practical, let's fix it, right? So, oh, you had a hard day. Okay, so what can we do to fix it? You got to just go tell that person, your boss, next time, da-da-da-da-da. And it's like this, like, you're completely missing each other, right? So the one person feels like, well, I'm trying to help solve the problem and fix it for them. And the other one's like, this doesn't feel good. I just wanted him to be able to hear me and listen to me. So it's recognizing, what is it that I need right now? I want emotional support. So am I asking for that correctly? Or is this even the right person to provide it, right? So if you think about for a minute, like just the people in your social support network. It could be family, it could be friends, it could be coworkers, it could even be people in the medical community. Think about what kind of support, what they're good at providing, right? So emotional support is, pretty much, that's pretty clear what that is. Some people are really good at that. Some people not so good at that, right? And that's okay, because they may be good at other kinds of support. So for example, informational support. So think of the people in your life that you know that maybe they wouldn't be the ones if you just needed someone to listen to you and sort of be able to vent to, but they might be really good. There might be people in your support network that would be really good if you needed help finding information, right? Or I'm trying to make this decision and sort of here's the pros and cons. Could I talk it through with you and maybe you could give me some more ideas? That's informational support. And then the other is tangible support, right? So tangible support is more like, who's someone I might be able to call on that I had a really crazy, crazy week and could just get some groceries for me when they're at the store, right? Or, my garage door isn't working and I don't know what to do. I don't have time to figure out what to do. Who could I call that might know how to fix it or might know someone that could help me, right? So some people are good at all kinds of providing support, but you may think of people in your life that, oh, well, maybe I was asking for informational support, but that's not their sort of talent or what they're good at or comfortable with. So sometimes this can really help when we're thinking about support and knowing what it is we need right now and who are the best people in our support network to provide that. Does that make sense? I see this a lot with you know, whenever families are dealing with stressful events, especially medical health issues, sort of they need that support, but they're not really sure about what kind of support do we need right now and who can we ask for that support. So the matching piece can be really helpful. Any thoughts or questions about that? Could any of you think of examples that just as we were talking where you realized like, oh, maybe I wasn't always clear in what I needed. Maybe I wasn't even sure what kind of support I needed. Or maybe I have better ideas of who to ask for support depending on what it is I need in that moment.
Not necessarily in terms of the example you just were looking for, but as you were speaking, you made one statement about as the parent or the spouse wanted to just fix it. I just want to fix the problem for them. Not just listen, well, obviously they're saying it because they want me to fix it, which isn't always obviously the case. But I think that's really the problem that parents or caregivers have for their children, particularly in our generation of parenting where we're kind of, we were indoctrinated into we'll just fix everything for them, leaving kids really less resilient. And this is a situation where, and you might be in a minority of parents these days that have no choice but to teach their kids to be resilient because you absolutely don't have the control to fix it. And then when it goes into the social support, as I was looking at that, it made me think of almost like a social judgment because as a result of any diagnosis for your children, you tend to become more lenient on things that really aren't that big a freaking deal. And then you might have social judgments or social whatever because why are they so lenient or why do they make such allowances? And because it's really not that big a deal and we're coping with something a little bit bigger, but people might not necessarily know it. So those are the things going through my head as you were speaking.
Yeah, no, those are really important, you know, things in terms of, that certainly comes into play too when you think about who you want to ask for certain types of social support, you know, and how much they understand the situation. I think in going back a little bit to what you're saying about the kids, although we're not focused so much about communication with your kids, but I think it is important too that sometimes, you know, kids also just need that emotional support. And we are very much always wanting to jump in and fix it. You know, they talk about especially preteens and teenagers that just using empathy sometimes can be so important to just being able to say, wow, I'm really sorry that you're having such a hard time with that or you're feeling this way. That sounds really tough. You know, and sometimes we need to be able to use that kind of communication with our kids too, rather than always just jumping in and trying to fix it, thinking that that is what they want. So that's a great point. Oh, and here they all are. So I want, just for my last point, I want you to think of, and the kids can all fit in very well with this too, they can practice their own sort of self-care plan, and they can support their parents in their self-care plan. But I hope you all leave today and reflect a little bit on some of the things we talked about and how you can start, it's a process, so it takes time, how you can start to put together your own self-care plan, right? Which means putting yourself first because you have other people in your lives that you have to take care of. So you need to make sure you're healthy and you have the energy. So these are things like health behaviors, if you have any medical issues, taking good care of yourself. We talked about pleasurable activities, hobbies, finding balance in your life. So I want you to think about this idea. So we talked about resilience, which is a great term. And I want you to think about thriving, right? It's not just like surviving, getting through each day. How can you make that one step above, which is really thriving, right? So what can I do to maintain or improve my health and well-being? Where can I find the support that I need? How can I start to develop a plan? Or maybe you already have a nice plan, but there are things you want to add to it that addresses my physical, emotional, social, and spiritual needs. How can I seek out help when needed? And how can I make positive changes in my life right now? So this could be changing some health behaviors, practicing adaptive coping skills that we talked about, reprioritizing what's really important in your life, and things like that. All right. So any questions or thoughts any of you have to that? Does that seem like a challenging idea of coming up with your own plan of how to thrive?
I usually present very strong, like I'm strong and that I have it together. And I think that Taylor has picked up on that. So a lot of times she's very independent. So when it comes to just being just relaxed and saying this is how I feel, she doesn't communicate that. And I don't know if me being so strong has hindered her from being able to be like, oh mom, this is what's hurting on me, because at times she'll handle something and I'm like, hey, why didn't you tell me? Oh, I took care of it. So I don't know if that's made, I'm kind of in a crazy place about that. I know that, I wanted to teach her to be independent, but then I didn't want her to just, she's only 14, so you trying to handle something like, something that, I feel like she should come and say, hey mom, I'm not feeling so good today, but she'll suck it up and she'll just keep going like she's mighty, like she's superwoman. And I guess she gets that from me, but I don't know how to help her tell me that she's not having a good day or that she's not feeling so well.
Yeah.
You understand?
Oh yeah, I understand, and that's a great example. So I think there's two things there, right? I think first, the best place, one of the best things we can do for our kids is to model, like, we can't always be strong. Things are hard for us, and we feel emotions too. But we're able to figure out ways to get through them. Sometimes we may not, the first time we try something doesn't work very well, right? So they can see that and they're like, okay, I can see that this is hard for mom and she's struggling right now, figuring out the best way to manage it or cope with it. And then, she's able to work through that. So that models that then our children are able to say, it's okay. I feel like I can talk with mom now when something's hard because I've seen mom talk to me, or she's come to me sometimes and told me that she's having a hard time, right? So I think that's the part of it. And then just the second, and then I'll get your thing. The second part is that this dynamic happens so often too, right? Where we're trying to be really strong for our kids, and then our kids are trying to be really strong for us, support us. So we have to let them know that it's okay. Like we'll be okay. We want to be able to support each other, so that they don't feel like I don't want to tell mom this because she's going to get really upset, and I don't want to upset her. So I think working on that dynamic, that could be really helpful. Yes, sorry.
I fall apart.
Well, it's not horrible. It's not horrible, right? It's just that's something part of that adapting and sort of figuring out what works, right? So she sees emotion in you and she wants to try to help. So think back to that social support. Like, how can she provide support to you? And then what are ways that you can provide support to her? So that you can both help and support each other when you need that. Right? But you don't want to label yourself either, right? That's just part of human emotions. It's hard. Right? Any other thoughts or ideas? Well, thank you very much. I hope that there are some helpful things today that you learned, and it's great being here. And thank you.